I'm Colleen Finnoff with TheraTogs Clinical Support video series. Tonight I wanted to talk to you about when you receive a system, what to expect, and what the contents are within the system. So first of all, when you receive your system, the first person that really should have access to it is your treating physical therapist. They need to access it to don your child, to strap your child, and they are going to be the one to know how to manage the TheraTogs system best. When you do get your system, I have an example of a full body system here with me. I wanted to describe that there are separate bags within the one bag, and just to go over those, just to clarify. Here I have a full body system. It's our most comprehensive system that has enough strapping to accomplish addressing the trunk, the hips, and any or all four limbs if you had to. So with all those strappings and parts, we have separated those parts into three separate bags in three different steps. So step one, which you see here, says open knee first. This contains the tank top and the hipster. So your therapist will go over donning the tank top and hipster snugly to your child. There's donning instructions within the bag to follow, but your therapist will follow this instruction first. That is step one. Step two contains strapping that would be addressed mainly for the trunk. That is typically where a therapist starts. So there's split straps, there's cross straps, there's some limb cuffs and extra tabs. But your therapist will understand by what their priority treatment goals are, what kind of strapping applications are necessary to begin with. So step two is typically being treated at the trunk. In the third bag, which is step three, it contains more strapping and enough to address all the rest of all four limbs if you had to. Maybe further advanced strapping for the hips, but there's enough strapping to further treat your child with it's step three. There's also an extra hipster and an extra tank front, and that is typically for when if your child would have any soilage or spit ups, any expected accidents from infants or preschoolers, you have an extra set to wear while the other set is being washed, so those can be rotated. In addition, in the bag, you also have two vanilla envelopes. One is specifically for the caregiver or the parent, and the other one is specifically for your clinician or the therapist. In the caregiver envelope, there's a pink product registration card that you will need to fill out and send back to TheraTogs. There's also washing and drying instructions and exactly what can be put into the water with the TheraTogs system. There's also frequently asked questions for the caregiver or the parent. And there's also directions for creating a summer tog if you needed to create more ventilation in the tank top if you live in a hot or more humid climate. This is a very simple way that's not going to take away from the functionality of the TheraTogs system, but can help create more ventilation for hotter climates. In the therapist envelope, there is a DVD that covers basic donning and basic strapping applications that they can review. There's a product list. There is our warranty and return policy. And there is a clinical reference guide that they can use as a resource. And lastly, there is a parts list, just checking through all the parts that should be included in the whole system. So that's when you receive your system, that's what to expect, and those are the layout. That's the layout of the basic contents. If you have any further questions, feel free to visit our Facebook page and just submit any questions you might have. You can reach me at support@theratogs.com, And next month, I'm going to talk about our clinical starter system and some new garment labeling that we're coming out with. So I look forward to talking to you then, and thank you again for visiting our clinical support video series.